Dear students, the focus of this module is diathermy. Diathermy is an extremely common modality used in sports medicine and physiotherapy. The learning objectives are to understand the meaning of diathermy, learn characteristics and effect of shortwave diathermy, know the indications and contraindications of shortwave diathermy, learn characteristics and effects of microwave diathermy, and know the indication and contraindication of microwave diathermy. Heating is a well established method of treatment of ailments since antiquity. Diathermy is a Greek word, means thorough heating. During late 1800, it was discovered that with high frequency alternating current, a relatively larger amount of current can be passed through the body, and these current produce a sensation of warmth but no contraction of muscles. This observation led the researcher to coin the term diathermy to describe the heating produced in the deeper layer of body through the application of electromagnetic energy. The subsequent research led to the development of methods of deep heating using electromagnetic waves. Earlier machines employed long radio frequency wave that was replaced afterwards by short radio waves due to technological ease. Almost parallel to the development of shortwave diathermy, another group of deep heating devices were developed that used microwaves to produce deep heating. At the same time, it was also observed that exposure to ultrasound waves can also produce heating to the deeper part of body. These devices were referred as diathermy, and according to the kind of energy used in these devices were named as long wave diathermy, short wave diathermy, microwave diathermy, and ultrasound diathermy. Long wave diathermy is no longer used in therapy, and after the non-thermal effects of ultrasound was discovered, the ultrasound was no longer considered as diathermy but as a therapeutic modality of its own kind. The characteristic feature of these devices is that they increase the temperature of deeper tissue without producing a corresponding elevation of the superficial tissue. This is known as volume heating. Normally, when we apply a hot pack over the surface of skin, the heat is transferred through conduction. So first the layer of skin will be heated up, then the fascia, and then the heat will go to the muscle. So at any given point of time, the temperature of muscle, deeper tissue, would be always less than that of the superficial tissue. Now, since the superficial tissue has a capacity for bearing the heat, and beyond a certain temperature it will produce burn. Therefore, it is not possible to rise the temperature of the deeper tissue to the same level as that of superficial tissue. The diathermy devices has overcome these difficulties because in these devices the heating is produced in the deeper tissue of the body first, and then it moves upwards to reach the skin. So therefore, the temperature of skin would always be lower than that of the deeper muscle tissue, and this is the advantage of the diathermy. This kind of heating is known as volume heating. In the present module, we shall discuss the biophysics, production, heating characteristic, effects and indications of both shortwave and microwave diathermy. First, we will talk about the shortwave diathermy, and thereafter we will discuss the microwave diathermy. At the end of the lecture, we would talk about the pulsed shortwave and microwave diathermy, and then we summarize our lecture. Shortwave diathermy is the application of short frequency radio waves to produce a thorough heating of the body tissue. Radio frequency waves are the part of electromagnetic spectrum that has wavelength of 3 to 30 meters and the frequency range of 100 megahertz to 1 kilohertz. These waves are widely used in radio and television communication. Radio waves are classified into three bands of long, medium and short wave. The waves of 10 to 100 megahertz are called short waves that has the wavelength ranging from 30 meter to 300 meter. The frequency of short wave allotted for medical use is 27.12 megahertz that has the wavelength of about 11 meters. All electromagnetic waves possess certain similar properties. They carry electric and magnetic energy and they do not require any medium to travel. Therefore, they can pass through a vacuum without any hindrance. When electromagnetic wave pass through a substance, its electric and magnetic field interacts with the electrically charged particles of substance and produce several effects in accordance with their energy level. The energy content of electromagnetic waves is directly proportional to the frequency. As the frequency increases, the energy content of wave is also increased. In comparison to other regions of electromagnetic spectrums such as X-ray or gamma rays, radio waves have the lowest frequency and thus they contain relatively much less energy. The energy quanta of X-ray and gamma rays are much higher. Therefore, when these waves are absorbed in the body, they can produce ionization of water molecule and the destruction of cell. Therefore, these waves are called ionizing radiations. These ionizing radiations are used to destroy the cancer cells. Short radio waves are non-ionizing radiations and as such they do not have any destructive effect on cells. When absorbed in body, these waves make the molecules and atom vibrate rapidly, which lead to the production of high frequency electric current within the tissue. It is the high frequency current generated within the tissue that serves to heat the tissue. The generation of electromagnetic radiation is the result of acceleration of electric charge. The artificial production of radio wave requires a source of high frequency current. The high frequency current are produced by discharging a condenser through an inductance of low ohmic resistance. This basic circuitry is known as oscillator circuit or LC circuit. It consists of a capacitor, the device that stores the charge, and inductance, a coil of metal having low ohmic resistance. The capacitor and inductors are incorporated in an electronic valve circuit. The frequency of produced current depends on the value of capacitance and inductance, and it is possible to generate high frequency electric current of different frequencies by suitably selecting the capacitance or inductance. In most of the shortwave diathermy devices, the inductance and capacitance are so selected that oscillator circuit produce a high frequency electric current of 27.12 megahertz, which emits short waves of similar frequency. A shortwave diathermy machine consists of two circuits, oscillating circuit and resonator circuit. The high frequency current are produced in oscillating circuit. The resonator circuit has a inductant coil, a variable capacitor and electrode. The inductance coil of resonator circuit is closely placed to the inductance coil of the oscillating circuit. Patient body part is placed between the electrodes and the patient body part act either as capacitor or inductor. Since the patient is also the part of electric circuit, the resonator circuit is also known as patient circuit. The principle of transfers of the generated energy to the patient body is similar to the working principle of electronic transformer and radio transistors. that make use of the phenomena of electromagnetic induction. In this phenomena, when two electric circuits are in proximity to each other, the magnetic field of electric current passing through one circuit can set up electric current in other circuit without being in direct contact with first circuit. When the product of the inductance and capacitance of both the circuit are same, there occurs maximal transfer of energy, and the current induced in the other circuit has the same frequency as that of the current produced in the first circuit. For maximal transfer of energy, product of capacitance and inductance of the patient circuit should match with that of the oscillator circuit. However, the inductance and capacitance of resonator circuit varies according to body part and the size and placement of electrode, and is different for each application. Therefore, in each application, the value of variable capacitor is adjusted to ensure that the product of inductance and capacitance of resonator circuit is matched to that of oscillator circuit. This process is known as tuning, and it is similar to tuning of a radio set. During application of diathermy, electromagnetic energy is converted into thermal energy through the production of electric current inside the tissue. According to electrical behavior, the living tissue can be considered as composed of three types of molecules: charged, dipole, and non-polar. Under influence of shortwave diathermy, there occurs acceleration of charged molecule, rotation of dipoles, and distortion of electron clouds of non-polar molecules. All these produce electric current and generate heat in accordance with Joule's law. The acceleration of charged molecule produces highest heat, followed by rotation of dipole and distortion of non-polar molecule. Therefore, during shortwave diathermy application, the tissue having high proportion of charged particle, such as highly vascularized tissue, are heated most. There are two principal methods of shortwave diathermy application. One is capacitor method and another one is inductothermy. Capacitor field method utilize the varying electric field, whereas the inductothermy utilizes the oscillating magnetic energy field. In capacitor field method, the body part is placed between two rectangular electrodes. The electrodes are separated from the skin by a layer of insulating material. The electrode serves as the two plate of capacitor, and body tissue and insulating material constitute the dielectric. This method of application utilizes the effects of oscillating electric field. In this picture, we can see the airspace drum electrode and the pad electrodes. There are two techniques of application of capacitor field method. One is coplanar method and another one is contraplanar method. Inductothermy or cable method uses inductive coil applicator in which an oscillating magnetic field is set up and the body tissue serve as the inductance. Two types of coil applicators are used in inductothermy: cable and monode. Cable is spirally wound around the body part, whereas in monode a compact coil is mounted on a plastic housing to be placed over the body part. A layer of insulating material should be placed over the skin while using both types of applicator. Inductothermy methods utilize the effects of oscillating magnetic field that set up eddy currents within tissue. Cable method is used for treatment of an extensive area which cannot be covered under the capacitive electrodes. It is also used to treat irregular areas of body such as hands and feet. Due to shorter pulse duration of the electric impulse, the high frequency current does not stimulate motor or sensory nerve. As the current is evenly alternating, it also does not give rise to accumulation of chemical substances in the tissue. The primary effect of shortwave diathermy is heat production within tissue. The subsequent physiological effects such as increased blood flow, increased metabolism, pain relief, increased extensibility of part, muscle relaxation, etc. are the effects of heat. Unlike infrared or paraffin wax, the heating pattern of shortwave diathermy is highly complex and strongly influenced by the technique of application. The shortwave diathermy has the ability to produce differential heating of body tissue. Shortwave diathermy can cause both deep and superficial heating. With variation in size and placement of electrodes, superficial as well as deep heating can be produced by capacitor method. Inductothermy produces negligible heating of fat and produce heating of the superficial tissue. In capacitor field method, which can produce both superficial and deep heating, the heating pattern differs according to the relative arrangement of tissue in the pathway of electric field. When different tissue lies parallel to the electric field, the density of field and thus the heat production is greatest in the tissue of low impedance. This happens when two electrodes are arranged in such a way that electric field passes longitudinally through the limb. In this situation, muscle and blood vessels are heated most, with least heating taking place to fat and bone. When the tissue are arranged transversely across the electric field, the density of fields can be uniform and the tissue of highest impedance are heated the most. In the electrode arrangement like that depicted in the picture, the subcutaneous fat tissue shall be heated the most. Since the purpose of application of shortwave diathermy is to produce deep heating, the superficial heating should be minimized by selecting the electrodes of suitable size, adjusting the spacing between electrode and skin, and by positioning the electrodes in relation to each other. Close spacing produce concentration of electric field in superficial tissue and give rise to superficial heating. Far spacing ensures the even distribution of electric field and produce heating in the deeper part of body. During uneven spacing, more heating under the closer electrode takes place. Similarly, the size of electrode in relation to the body part affects the extent of heating. Depending on the condition, the treatment is applied for 20 to 30 minutes either daily or on alternate days. The parameters of shortwave diathermy is not precisely controlled, so it is difficult to quantify the amount of heat transferred to the tissue. The dose of shortwave diathermy is decided by the patient perception of warmth. The heating sensation produced during shortwave diathermy application is usually mild. Patient should feel much less warmth than that felt during application of hot pack. The following 4 dose levels are used in clinical practice. Level 1 is imperceptible heating, level 2 is mild perception of warmth, level 3 is comfortable perception of warmth, and level 4 is the perception of same warmth as felt during application of hot pack. Level 1 and 2 dose are used in acute inflammation. Level 3 is used in chronic inflammation and long-standing cases. Level 4 dose is normally not used in day-to-day practice as it may increase the temperature of deeper tissue to dangerous level. The shortwave diathermy allow greater depth of heating than that occurs with superficial heating agents such as paraffin wax bath, hot packs or infrared. Heating of tissue leads to increased blood flow to the part and a number of related physical and metabolic changes. The other effects of heating are increased extensibility of deep collagen fiber, decreased joint stiffness, relieve deep pain and muscle spasm. Heat also produces sedative and counter-irritant effects that serves to reduce the pain sensation. The rise of muscle temperature contributes to increased muscle relaxation and increased muscle blood flow that makes the movement efficient. Application of heat aids in resolution of subacute and chronic inflammation. The increased blood flow brings cells, enhance their metabolic activity and contributes to accelerated resolution of inflammation. Shortwave diathermy is particularly beneficial for treating deeply placed structure such as hip joint. In conjunction with other electrotherapeutic modalities and exercise, it is very commonly used in the management of rheumatoid arthritis, osteoarthritis, capsulitis and tendinitis of deeply placed structure, low back pain, knee pain, and the muscle spasm associated with trauma and inflammation responds well to shortwave diathermy. Shortwave diathermy sometimes is also used in case of infections such as pelvic floor inflammation or infected surgical wound. In comparison to other heating modalities, shortwave diathermy offers several advantages. With drum electrodes, it is a non-contact heating that can be used in the condition when skin is tender and unable to tolerate any pressure. It can increase the temperature of a larger area, and in the obese person, it is possible to ensure deep heating. Burn is the inherent danger of any heating modality, and shortwave diathermy is no exception. Concentration of electric field and inability to dissipate the generated heat has the potential to raise the temperature of tissue beyond the safety limit and produce the destruction of tissue. Therefore, every attempt should be made to ensure that SWD is not administered where there is a chance of damage to the tissue. The contraindications of shortwave diathermy include metal implant, impaired thermal sensation, hemorrhage, venous thrombosis, arterial disease, and inability to communicate. Inability to control movement of body, ischemic tissue, malignant tumor, and recent radiotherapy are the other contraindications of shortwave diathermy. Metal and sweat causes concentration of electric field and overheating. The condition where the venous and arterial supply of the part is not proper, the shortwave diathermy application should not be considered, as these tissues are not able to dissipate the heat, which could result in excessive heat buildup. The perception of heat by the patient is the only way to know the dose of shortwave diathermy. Therefore, in conditions where patient is unable to perceive and communicate the thermal sensation, the chance of excessive heating is very high. Recent hemorrhage, acute inflammation, and the condition where there is increased risk of hemorrhage may be aggravated by the application of heat. Owing to fear of proliferation and spread of cancer cell in response to heating, shortwave diathermy is not applied over malignancy. Now we shall discuss the biophysics and effects of microwave diathermy. Microwave is the part of electromagnetic spectrum that lies between infrared and shortwave. Wavelength of these waves ranges from 1 centimeter to 1 meter with frequency ranging from 30 gigahertz to 300 megahertz. The artificial production of microwave started during 1930s following the quest for development of sophisticated radar system. For therapeutic purposes, microwave diathermy were made available during 1960 and 1970s. The most common use of microwave is in the area of phone communication and radar. These waves are also used in establishing communication system in satellite and rockets. For medical use, three frequencies of microwave diathermy are allotted. Among them, frequency of 2450 MHz is commonly used, that emits a wavelength of 12.24 cm. The use of other two frequencies are not so common. Microwave produced heating is now a common knowledge due to widespread use of microwave oven. Barring few characteristics, the indication, contraindications and use of microwave diathermy is almost similar to that of shortwave diathermy. In sports medicine, the microwave diathermy is used much often than that of shortwave diathermy. Microwave is produced by a device called magnetron. This device generates high frequency current directly from high velocity electron motion. These currents are collected and sent to an emitter through coaxial cables. The emitter is mounted in front of a metal reflector that emits microwave in only one direction. The power supplied to magnetron is controlled to regulate the output of magnetron. The microwave diathermy machine has a power output meter and a timer that precisely control the exposure. Like shortwave diathermy, microwave diathermy can also be delivered either in pulsed mode or in continuous mode. Now we discuss the physiological effects of microwave diathermy. Therapeutic microwave is largely absorbed in the first few centimeters of body. The absorption of microwave generates a high frequency current in the body due to movement of charged particles, rotation of dipoles and electron orbit distortion, and this produces heat. The pattern of heating after exposure to microwave diathermy depends on the electrical properties of tissue and the density of microwave in the area. Microwave is strongly absorbed in water and water containing tissue. It is not absorbed in fat. Therefore, with MWD, it is possible to raise the temperature of muscle while avoiding heating of the subcutaneous fat. MWD is most commonly used in subacute and chronic inflammation of muscle as encountered in muscle contusion and strain. Combination of MWD with stretching helps restore the length of tight and contracted muscles. It is a suitable method to treat superficial muscle and joints close to surface, but it is not a suitable technique for deeply placed joints such as hip. It can be successfully used to increase the temperature of the small joints of fingers. The treatment time of microwave diathermy is usually 20 to 30 minutes. The intensity is regulated by the sensation of warmth reported by the patient. Contraindications of microwave diathermy. Like shortwave diathermy, microwave diathermy should not be used in the areas of diminished thermal sensation, defective arterial and venous circulation, acute hemorrhage and recent inflammation are the absolute contraindication of heat therapy. In addition, metal in the tissue such as plates, screws, cardiac pacemakers, etc. should be avoided as there may occur considerable reflection leading to excessive temperature rise in the surrounding tissue. The foregoing discussion pertains to the continuous application of shortwave and microwave. Due to technical advancement in technology has made it possible to deliver shortwave or microwave in pulsed mode. The foregoing discussion pertains to continuous application of shortwave and microwave. Advancement of technology made it possible to deliver shortwave diathermy and microwave diathermy in pulsed mode, where the flow of wave transmission is interrupted at regular interval. This gives a pulses of different duration. Pulse mode deliver relatively less energy and little heat is generated during the period. Pulse mode delivers relatively less energy. Any little heat generated during on period is rapidly dissipated during off period and there is no heat buildup in the tissue. Therefore, pulsed mode is also known as athermal therapy. With regard to the physiological effects for pulsed shortwave and microwave diathermy, two different views are expressed. One view claims that the effect of pulsed shortwave or microwave diathermy are actually the effect of very mild imperceptible heating. The pulse mode is considered to minimize the intensity of thermal effects and utilize the effects of very mild heating on the metabolic functioning of cell involved in inflammation and healing process. The other view states that pulse diathermy may produce some effect which are not due to heat but due to other mechanism that may lead to enhanced functioning of cell, alteration of ionic environment of cell due to movement of ion and molecule under the influence of oscillating electromagnetic field leading to alteration of membrane potential and permeability of cell and utilization of absorbed energy for chemical works are some of the suggested non-thermal effects of pulse diathermy. However, it should be noted that these explanations are entirely speculative. Nevertheless, some clinical studies have demonstrated that application of diathermy in pulsed mode accelerate wound healing and promote regeneration of nerve. Pulsed diathermy are used in acute and subacute inflammation where continuous diathermy is contraindicated. In this module, we have discussed two methods of diathermy that use electromagnetic waves to produce heating of the deeper part of body. The wavelength of short wave is larger than that of microwave and it has greater penetration ability. Shortwave diathermy provides the deepest heating while the microwave diathermy heats only structure laying few centimeters below the skin. Heating of subcutaneous fat is largely avoided in microwave diathermy, whereas in SWD considerable heating of fat tissue do occur along with heating of deeply placed structures such as joint capsules. The dose of both modalities are determined on the basis of patient's reported sensation of warmth. Therefore, impaired sensation and inability to dissipate heat are the absolute contraindications of both the modalities. Pulsed mode of diathermy do not produce rise of temperature and it is used in those conditions where the continuous diathermy is contraindicated. Friends, in this module we have discussed the biophysics, production, effects and contraindications of both shortwave and microwave diathermy. We know that diathermy means thorough heating, and in fact when we use the term diathermy we are referring to deep heating modality. We have discussed that these two modalities share several similarities, yet they are different in many aspects. Shortwave diathermy uses short waves, whereas microwave diathermy uses microwaves. The wavelength of shortwave diathermy is larger, therefore it penetrates much deeper than the short waves of microwave diathermy. Therefore, shortwave diathermy provides deepest heating, whereas the heating effect of microwave diathermy is confined to the first few centimeters of skin. There is also a difference between the heating pattern. Microwave diathermy does not produce any heating of the subcutaneous fat, whereas the heating of subcutaneous fat cannot be avoided in shortwave diathermy. In different techniques of shortwave diathermy, the electrode position and the spacing between the electrode and the size of electrodes are used to avoid as far as possible the heating of subcutaneous fat. The dosage of both the modality depends on the perception of the patient's warmth. Therefore, if the patient is not able to feel the heat and also if he is not able to communicate the heat sensation, these two modalities should not be applied, as it will lead to excessive application of energy which may produce burn. Both shortwave and microwave diathermy produce heating, and the physiological effect and therapeutic effects of these modalities in general are the therapeutic effect of the therapeutic heating. The effects associated with both kind of diathermy are the effects of heat or elevation of tissue temperature, which produce several therapeutic effects. The pulsed mode of diathermy do not produce rise of temperature, and it is used in the condition of acute inflammation and acute injuries, where the shortwave diathermy and microwave diathermy is actually contraindicated. Thank you.